Welcome, and thank you for joining us for supporting families through best practice, an overview of the standards of quality for family strengthening and support. My name is Mary Robinson Griffey, and I'm an administrative coordinator with the National Family Support Network, and I'll be your presenter for today's webinar. If you're joining us online, you may listen directly through your computer speakers. If you've joined via the phone number that Zoom provided, your line has been muted to minimize background noise. For those of you online, please note the link to the Dropbox folder in the chat. Here you will see that there are some handouts available for download. In addition, you may put questions in the question and answer section at any time. The chat section is open for you to include any comments during the webinar, but we ask that you direct all your questions to the Q&A section of Zoom. If you are having tech issues, our live tech support will be here to help you. And I will try to get to all questions at the end of the webinar. However, if I'm unable to do so, someone from the National Family Support Network will follow up after this webinar. And finally, I'd like to mention that today's PowerPoint, the handouts, and a recording of this webinar will all be available on the National Family Support Network website on the Webinar Wednesday page this time tomorrow. And when you exit the webinar, an evaluation will automatically appear on your screen. And we ask that you take a moment to complete this as it provides us with some valuable feedback to inform future webinars. So now as we get started, we'd like to get an idea of who is joining us here in the webinar room. So I want to show you this map. You can see how we've divided the nation into regions. So as you look at this map and you see where you are, we're going to now launch a poll and we're going to ask you to respond and let us know where you're joining us from today. I'll give you just a few more minutes to respond to that poll. All right, let's see those results. All right, so we've got representation from all over the United States today, with our highest representation from the West, closely followed by the Midwest, the South, and then the Northeast. So we're so excited to have each of you here with us today. So let's go ahead and launch another poll. We've got a couple of more questions that we'd like to ask, which is going to help us get a sense of who is joining us today. So this next one is all about your affiliation. So let us know what type of organization you work for. Do you work for a family resource center or perhaps a family resource center network? Are you a parent leader or education, maybe a government? When I think we have a couple of types of government that you might be joining us from, or maybe you're a funder. We've also included others. So if you do check other, please add into the chat for us what that other affiliation is you're joining us with. All right, let's see those results. All right, so we have representation all across the board today. I see the Family Resource Center is the highest representation. I did miss that we don't have anyone here with the network, but we do have other family support programs, parent leaders, early care and education, other education, and both of our governments. And then I'm seeing some in the chat. Community Action Agency, nonprofit mental health programs. So we're so excited that you're all here with us today. So let's get to that final question, which is about the level that you're working at within your organization. So are you at the program level? Are you doing direct service perhaps, or management level, policy systems level? Again, we've included that other. If you check that, please share in the chat that level that you're working at within your organization. Oh, I love that, Lisa. You're getting ready to start that parent advisory committee. Love that. We have someone joining us who's in training and in management. Well, let's see those results and see how everyone else that's joining us. Okay, so great. So the majority are from that program direct service level at their organization. Then we have the next representation is management level, and then those policy systems level. So we have representation from everybody. We have family resource coordinators, owner directors. I'm so excited you're all here, and this diversity is really going to be great for this webinar. So thank you all for joining us. So I'd like to start our conversation today by sharing a little bit about the national network so that you have a little context as we dive in. So when it was founded in 2011, there were just 8 states that were green on this map. But over the last decade, the National Family Support Network has more than quadrupled in size, and it now has 38 member networks, and that's 37 states plus the District of Columbia. And they represent more than 3,000 family resource centers that serve more than 2 million people annually. Our mission is to promote positive outcomes for all children, families, and communities by leveraging the collective impact of state family resource center networks and championing quality family support and strengthening practices and policies. Our vision, in short, is that the whole map you just saw will be green, which will ensure that all families will have access to quality family support services in their communities that are provided by family resource centers, which are supported by strong networks. So if you're in one of those states that is not yet green, we would especially like to connect with you to discuss and learn about what's going on in your state. So next, I'd like to share with you a little bit about the work that the National Network does. Our first bucket of work is connecting and convening member networks to enhance their effectiveness, increasing connectiveness amongst members for peer learning and mutual support. Our second area of work is promoting family support best practice and evaluation, raising awareness of what quality family support is and promoting a common language, standards, and evaluation of it through the national implementation of the standards of quality for family strengthening and support. And then that third area of work is raising the visibility of the value and impact of family strengthening and support networks. And that's in order to strengthen and increase support for families. So here's a little roadmap for our time together today. So let's take a look at what we're going to be covering. We're going to be doing this little brief background of the standards, and we're going to review the standards have an overview of those. And then we're going to look at standards implementation at the program level and also that systems level. We'll end today with some questions and answers, and then we'll provide you with some resources and opportunities that are available through the National Family Support Network. And finally, as I mentioned before, as you're leaving the room, you'll be prompted to take an evaluation, and we do encourage you to do that as it is such valuable information for us. So when we talk about these standards, our focus is on families, and in particular, families who are responsible for raising children. These families consist of at least one adult and one child who are related biologically, emotionally, or legally. And families may consist of one parent, two parents, grandparents, foster parents, legal guardians, or they just may arise from a need for mutual support. Here you can see a little bit about the timeline of the standards being developed. The standards of quality were developed in 2012 by the California Network of Family Strengthening Networks, based on an earlier version which was developed by the San Francisco Family Support Network in 2007. They were adopted for national implementation in 2013, and in 2020, they were thoroughly revised with a particular focus on diversity, equity, and inclusion and input from across the US and Canada. And that newest version of the standards, well, it was issued in March of 2021. So as we talk about the standards, you might be wondering, why are they so important? And I'd like to mention a few things here. They help ensure that families are supported and strengthened through quality practice. They create a common language and expectations across different kinds of family strengthening programs, and they're designed to be used by all stakeholders. So public departments, foundations, community-based organizations, and families. And they're used as a tool for planning, providing, and assessing quality practice. Now, the documents of the standards themselves, as well as all of the implementation tools, are available for free on the National Family Support Network website. And we want to underscore that we're not selling the standards. We want everyone to have access to and to think about quality work with families. So I encourage you to go to the website, which our tech will share that link for you in the chat. Once you're there, you just hover over standards. You'll get a drop-down box and you'll drop down to overview, and it's right there on that page where you'll be able to download the standards. You can also navigate from that point to the implementation page, where you're going to find access to all of the implementation tools that we're going to go over during this webinar. So I encourage you to check that out. Now, when we're talking about these standards, we want to underscore that everyone can use these. So for those of you who are here with us today that are representing family strengthening and support programs, you can use these standards as a blueprint for implementing best practice, for self-assessment, and to demonstrate quality. We didn't have anyone with us when we first started today that was with direct service staff. Actually, we did have some direct service staff. It was networks we didn't have. So for those of you who are here with us that are direct service staff, you can use these standards to reflect on and enhance your work with families. For those of you who represent networks, and that's the ones that we didn't have any representation for earlier, but for them, they can support providers. They can use these standards for quality assurance, for training and technical assistance, for capacity building, and they may use them to adopt them as criteria for network membership. We did have some policymakers with us today, and you can use these, the standards, to endorse for application in areas of influence. For those of you who are joining us today who are funders, you can integrate the standards into requests for proposals, monitoring, and quality assurance. And for those of you who represent families who are participating in programs who are so integral to this process, you can partner with programs to apply these standards. And you can provide feedback about how well the program is doing applying the standards. At the program level, implementing the standards effectively requires the commitment and the support of all levels of program responsibility: executive directors, managers, coordinators, direct service staff, parent leaders, and families. All of these groups are coming together and they're working to implement the standards at the program level. The standards bring together two foundational frameworks from the family support and strengthening field. The first is the Principles of Family Support Practice, which was developed by Family Support America. And the second is the Strengthening Families approach and its evidence-informed 5 protective factors. You may also know of this as the 5 protective factors. So let's do another poll. I'd like to know how many of you have heard of the 9 principles of family support practice before today? Give you just a few more seconds to finish up this. All right, let's see those results. All right, so the majority are a no, but we do have a strong contingency here that's yes. So for you all, this is going to be a little bit of a review, but when we're through, all of you that said no will be able to say that you have heard of these before. So great, let's get right into these. All right, the principles were developed by a national organization, as I mentioned, the Family Support America, in 1981. And these principles continue to guide and frame the field today. So the principle one is that staff and families work together in relationships based on equality and respect. Now, while this principle may not seem so revolutionary today, at the time that it was written, it presented quite a challenge to the system. At that time, the prevailing wisdom was that the staff were the experts with their education, their knowledge, and their experience, and their goal was to fix the problem family. But this principle challenged that notion by saying that staff and families are equal. The staff do come to the table with their education, their knowledge, and experience, but the families also bring their own strengths and resources, and they are the most knowledgeable about their past experience. And it's by working as partners in relationships based on equality and respect that we will achieve the best outcomes for families. Principle number two is that staff enhance families' capacity to support the growth and development of all family members, adults, youth, and children. Now, this principle emphasizes that we in the family support field look at the whole family and not just the individual. If only one member of the family participates in our activities, we want to be asking about and inviting other members of the family as well. We know that when multiple family members are involved, the family will be more likely to have better outcomes. Principle number three is that families are resources to their own members, to other families, to programs, and to communities. It's unique to the family support perspective that we do not see staff as having all the answers or even doing all the work to support families. Families themselves are encouraged to support other families. There's a strong emphasis on connecting families to share resources such as information and peer support. Principle number four is that programs affirm and strengthen families' cultural, racial, and linguistic identities, and they enhance their ability to function in a multicultural society. So this principle, which is commonly referred to as the diversity principle, has two parts. That first part is about respecting and welcoming the diversity that families bring, whether it be linguistic diversity, cultural diversity, family structure, whatever it may be. And that second part is about preparing them for and connecting them with the larger community where they will naturally interact with people who are very different from themselves. This will support them to fully participate in the diverse society in which we live. Principle number five is that the programs are embedded in their communities and contribute to the community building process. So family support programs do not see themselves as simply social service providers, but rather as community builders. By strengthening families, they make a key contribution to the health of their communities. They also work to develop families' responsibility and leadership for strengthening and building their communities. Principle number six is that programs advocate with families for services and systems that are fair, responsive, and accountable to the families served. So I want you to think about some of the major systems that families commonly interact with. For example, there's education, healthcare, the legal system. And then I want you to ask yourself, are all of these systems fair and responsive, and are they accountable? Sadly, often they're not. And that's where our work comes in as family support providers. We work with families to help improve these systems. Principle number seven is that practitioners work with families to mobilize formal and informal resources to support family development. Now, there's a strong emphasis in the family support field on resources. And the most common type of family support program, well, it's called a family resource center. So you see it's right there in the name, with the emphasis on resources. And while no program can directly provide all the supports that a family might need, it is our responsibility to know how to connect them to them. Principle number 8 is that programs are flexible and continually responsive to emerging family and community issues. The concepts of flexibility and responsiveness are very important in the family support field because neighborhoods and communities, well, they change. A neighborhood that is majority Latino today, well, it might be majority Asian in 5 years. And issues emerge that significantly affect families, such as an economic downturn. Programs need to be flexible and responsive to these changes. Principle number 9 is that principles of family support are modeled in all program activities, including planning, governance, and administration. So we refer to this as the catch-all principle because it basically says that all of the above principles should be applied in everything that you do: planning, governance, and administration. These principles have implications for how we develop programs, how they're led, and how we support our staff. So that's the first framework on which the standards are built. So now we're going to look at that second one. So we're going to launch another poll. I'd like to know how many of you have heard of the Strengthening Families Protective Factors Framework, or those 5 protective factors for short, before today. All right, so I'll give you just a couple more seconds to respond to this poll. And let's see those results. All right, so the majority of you have, for this one, have heard of those protective factors framework. We do have a few here that have not, so I'm just going to do a brief overview of these for you. This framework was developed by the Center for the Study of Social Policy back in 2005, and it is research-based and evidence-informed. Research has shown that these 5 protective factors increase family stability, it enhances child's development, and it reduces child abuse and neglect. So we're going to just take a brief look at what those protective factors actually are. You can see them right here on the slide. There's parental resilience, social connections, concrete support in times of need, knowledge of parenting and child development, social and emotional competence of children. We do invite you after today to dive into these and learn more about them. There's tons of information on the Center for the Study of Social Policy's website. So if you just go to cssp.org, from there you'll want to click on the Strengthening Families tab. And there you'll be able to dive right in and learn all about these protective factors. And that's the second framework that the standards are based on. So the standards themselves have 5 sections, and each represent a key element of quality practice. There's family-centeredness, family strengthening, diversity, equity, and inclusion, community strengthening, and evaluation. And each of these sections are very important. So when we're talking about the standards, there are actually 15 of them within this framework. And each standard includes 1 to 2 sets of indicators, and they're both foundational and high quality. The foundational quality indicators demonstrate that basic application of the standard, and then programs build upon the foundational quality indicators to achieve high quality indicators, and that represents deeper integration of the standard. Each indicator is followed by 2 to 4 examples from the field that illustrates its application. These examples are provided as illustrators and not meant to be a checklist or limited to the ones cited. In the certification training on the standards, a significant focus is on participants thinking of their own examples that demonstrate the indicators in ways which are relevant to their programs. And as programs apply the standards, they're encouraged to identify their own examples that demonstrate the indicators in ways that are relevant to their communities. So let's look at this together. We're going to look at the difference between foundational and high quality. So foundational quality indicators create a solid foundation for family support and strengthening programs. Foundational quality indicators are designed to be met within the basic resources of a typical family support and strengthening program. Now, those high quality indicators are built upon foundational quality being in place first. So we don't just jump to high quality. We need that foundation under us. And programs are encouraged to strive to meet high quality indicators in order to serve families most effectively. We do want to mention that some high quality indicators may require additional capacity building or additional resources in order to meet. And now let's look at the bottom of the slide together where you're going to see that continuum of quality practice. We start with foundational quality not yet addressed, and then we approach foundational quality. Then we meet foundational quality. And this is where quality really begins. Then we continue along the continuum to approach high quality, and then we meet both foundational and high quality. Now you'll see at the bottom that the arrow keeps going after we've already met foundational and high quality. And that's because quality improvement is an ongoing and continuous process. And that's why you'll never hear us say maximum quality. We'll always refer to it as high quality. Implementing the standards is a developmental process, and it's common that programs may see aspects of their work at different points on the quality continuum. As we go through the standards today, you may determine that you are already doing quality work in various areas, and you may also identify areas that you need to work on further. So for the first 4 sections of the standards, this is the arrow that we use to explain that movement from foundational to high quality. On the left, you see foundational quality. On the right, you'll see high quality. And then you'll see that arrow, which is what moves us to that deeper integration of high quality, those elements that move us. So what we see in the arrow is formal structure. That's our first one. And that's design, policies, procedures, and intentional strategies with committed resources that ensure consistency of practice. The next one is staff training. So we want to make sure we're supporting our staff by getting them the training they need to implement the standards. And then finally, you see family partnership. We're partnering with families in the implementation of the standards. Now, each of these elements helps ensure that the standards are more deeply integrated into program practice. For example, at foundational quality, well, we may do something that is really good practice, but how do we ensure that it wasn't a one-time occurrence? At high quality, we've set up systems, we have trainings, and/or we've partnered with our families to ensure that it will continue to happen. Now, the particular elements and the number of elements needed for high quality differ for various indicator pairs. Sometimes it's going to be 1, sometimes 2, and sometimes it's going to be all 3, but it's never going to be anything other than these 3 elements. So let's take a look into the standards. This is an actual page out of the standards that we see here, and we're going to look at standard FC1, with that FC standing for family-centeredness. And this standard states that the program engages families to participate in program development and implementation. That foundational quality indicator states that the program solicits input from families to shape and plan the program and services. So now let's look at the difference in foundational and high quality. You can see in the arrow that we have formal structure and family partnership, and that's how we're going to get to high quality. Now, if you look at that high quality indicator, you're going to notice that the formal structure and that family partnership, which is in our arrow, has been bolded and italicized right there in the indicator. We want to make it very clear what it is that's needed to get us there. So we see design and partnering with families. That's what we need to get us to that high quality indicator. So now let's fast forward to that evaluation section. And the evaluation section is so cool that it gets its very own arrow. I know a lot of people either love or hate evaluation. I love evaluation. I look at it as a way to improve our programs and not prove our programs. So I love evaluation. So as with that arrow in that first 4 sections of the standards, we see foundational quality on the left and we see high quality on the right. And that represents that deeper integration. But the elements in the arrow are a little bit different. So here we see that we have data analysis. Now, the collection of data is foundational, but when you start to analyze it, that's what's going to move you to high quality. Also, sharing those evaluation results, and you share those with various stakeholders, like your families that you're working with. And then finally, we see program modification. And that means changing the program as a result of what we learn from evaluation. We're not just doing evaluation for evaluation's sake. We're actually going to do something with it. So there's several tools that we offer with the standards that you can use with the evaluation section. So let's take a peek at these tools. There are 3 of them, and they are available to you under the Implementations tab on the National Family Support Network website. So that first one is the Program Self-Assessment tool, and it's designed to be used as a critical thinking exercise by program teams. Managers, direct service staff, parent leaders, all of them come together to work on this tool. We do recommend that all team members involved in using this tool have been trained on the standards first. Next, you'll see that staff self-reflection tool, and it consists of 18 self-reflection questions. And staff members use these as an ongoing reminder of how to implement the standards. We encourage staff to put it in a place that they can see it regularly, such as over their desk. Then you see that standards participant survey, which shows how well the program is meeting the standards from the participant's point of view. It's not a typical satisfaction survey. The questions mirror those on the staff self-reflection tool. So if staff members are mindful of those questions, then the program participants are likely to give the program high scores. And as I mentioned before, all of these tools are available on the NFSN website and are included in the standards training. Sorry about that. So the next thing I want to talk about is training, because it is fundamental strategy for implementing the standards effectively. So we do offer a certification training. These trainings are either in person or virtual and are designed for all management and direct service staff, as well as for funders. Participants will receive a certificate that is valid for 2 years from when they are trained. I do want to mention that we are so glad that you're here with us today for this webinar, but just as a reminder, this is not the training. So in order to receive a certificate, you'd want to participate in the certification training. Certification trainings are conducted by pairs of trained trainers from the member networks from across the National Family Support Network. Networks, funders, and other stakeholders can also contract with the NFSN to host a certification training for programs in their area if there are not standards trainers in their state. Programs are highly encouraged to come as teams of both management and direct service staff to the training, because successful application of the standards requires the commitment and the support of all levels of program responsibility. And individuals are certified, not organizations. And that integrates the standards into everyone's daily work, and it provides a professional credential for staff. All trainings are live because the group work and the peer sharing are very valuable to the process of learning about the standards. Now, the Training of Trainers Institute is a 4-day in-person or a 5-day virtual training for representatives of National Family Support Network member networks. And that this provides them with the ability to conduct the certification training in their state. Only network representatives are trained to be trainers, which supports their capacity building and establishes a unique, essential, and ongoing role for them within the system of support for families in their area. So let's take a look at where these standards have been over the past decade. So you can see we've trained over 14,500 people on the standards, and there are over 100 trainers that are currently delivering this training from across member networks from the National Family Support Network. And we encourage you to stay tuned, because this map continues to grow and change each month, and it can be found on the National Family Support Network website. So let's look at some training impact data. We'd like to give you some information from some folks across the country. We see that 91% are saying that the standards are enhancing their work with families, and at least 85% indicate that they are using these tools. So here's some more information. I'll just give you a minute or so to read these quotes from across the country about training impact. Well, as you see here, the standards help validate existing work by benchmarking it to national best practice. So let's take a look at how the standards support network development. Networks are formed and expanded through standard certification training. For example, in Arizona, the standards provided a common language for diverse providers across the state, and it established a key role for the Maricopa Family Support Alliance in promoting quality practice within their system of care. As a result, the Alliance grew from 21 to 72 agencies in just a few short years. You can also see that networks are strengthened. They have strengthened capacity and sustainability through developed trained trainers. And all funds that are generated through the standard certification training are invested back into supporting those networks. So in order to ensure the accessibility and affordability of the standard certification training, networks with certified trainers may only charge participants up to $150. It's intentionally keeping it affordable so that everyone is able to access it. So now let's take a look at this tool. And I just want to mention, because I know the print is really small, that this can be found on the website under that implementation tab, which is you go to standards and drop down to that implementation tab, and you can find this tool there. And I know that we had some program level folks that were joining us today, and this you might find this tool particularly helpful. You're going to notice that there are steps across the top, and then there are some sample activities associated with each of those steps. Below that, you're going to find resources and potential cost right there at the bottom. And we encourage you to download this and check this out. Want to mention that by being here today, you're already at that prepare stage just by checking out this standards overview webinar. And we encourage you to look at this and plot your path moving forward. So prior to joining the NFSN just a little over a year ago, I was the coordinator for a school-based family resource center in the state of Kentucky. And when I began working at that family resource center, and it's hard to believe it was over 20 years ago, we were providing parent and child groups and activities. We were providing parent education and parent groups. We were providing information referral to families, and we were doing lots and lots of really great work serving families, the best that we knew how at that time. But after developing their own trainers through the National Family Support Network, the Kentucky Family Resource and Youth Service Centers Network offered the standards of quality certification training to managers, directors, and direct service staff from across the state. And it was through implementing those standards that my Family Resource Center saw how valuable those standards were in enhancing the work that we were already doing. We were able to increase childcare offerings for parent education opportunities, and that in turn increased our ability to meet parent needs by reducing as many barriers to participation as possible. We intentionally improved our partnership with parents, and we increased the involvement of our fathers by implementing a program called Watchdogs, or Dads of Great Students program, where we got our dads involved, coming to the school and spending time with children, providing that male role model for those children while they were at school. The standards also provided us with the structure to increase our formal structure around our outreach strategies. And also, we were able to increase community collaborations which in turn enabled us to be able to provide ongoing learning for our students through increased summer programming opportunities. They were definitely a game changer for our Family Resource Center. So now let's look one level up at that network level. The networks are the ones that are bringing those individual programs together, and here's our roadmap that the networks can use as they're using the standards. Now, it's set up in a very similar format, and again, you can find this on the website on that implementation page, so you can download this. You're going to see those steps right there along the top. You're going to see some activities, various resources, and then those potential costs associated with each of those right there at the bottom of the page. By being here today, those networks are already at that prepare stage, and we encourage you to download this and to take a look and see where you are and plot out some future and next steps. And we also encourage you to reach out to us if you need any guidance or support as you venture along this journey. I'd like to share with you an implementation diagram from one particular network that demonstrates how they implement these standards as a network. They're using a three-pronged strategy that integrates them into training, evaluation, and membership. We do encourage all networks to develop their own network level implementation plan. This diagram illustrates how the Colorado network has tiered their trainings for Family Resource Center staff. All of their staff at their centers, regardless of their roles, complete the standards certification training. Then staff working with families and their supervisors complete a free 14-hour online Strengthening Families training, which is offered by the Children's Trust Fund Alliance. And then staff working directly with families in case management roles, well, they complete a 60-hour family developmental credential. So as you're processing all of this, and I know it's a lot of information, you might be asking yourself, why are the standards and how are they beneficial to you? And so I've got some things for you to consider. The standards deepen practice. They establish a common language across many different kinds of programs, such as Family Resource Centers, home visitation programs, and all of those programs, they come together and they speak that same language. They're also an opportunity to develop partnerships and to utilize shared measurement systems. Also, they provide a concrete way to advance diversity, equity, and inclusion. And the standards are your opportunity to be part of a national movement. So after these webinars, a lot of times we get emails asking us what next. So we encourage you to download those standards if you haven't done so already. You can do that by going to the NFSN or National Family Support Network.org. You'll hover over the Standards of Quality drop-down, and that's where you'll see the overview, and that's where you'll go to download those standards. We also encourage you to review possible next steps along the program or network standards implementation continua that we shared. Again, you can find that by going to the National Family Support Network.org website. Hover over standards, click on implementation tools, and you'll find both of these continua as well as the other tools that were highlighted today right there on that page. We also encourage you to participate in a standard certification training, either offered by your state network or by the National Family Support Network. For funders in states without networks currently offering the standard certification training, you can review the standards training page to learn about how to contract with the NFSN to bring that training to your state so that you can benefit from it as well. To do that, you would just go to the National Family Support Network.org, click on standards, go to the certification trainings page, and there you'll see all of those upcoming standards trainings scheduled across the country. You'll notice at the bottom of the page is an area where you can reach out to contacts in your state. So if you don't see a contact there, that probably means that your state is not currently offering the training. but you can bring them to your state or participate in an open training to check them out. And we definitely encourage you to do that. All right, so now we've come to the moment for questions and answers. I don't see any questions in the chat box yet. I do see a question in the webinar chat about how long the certification training is. Currently, the certification training is offered virtually only. We're working on an in-person version right now, but that in the virtual version is over 2 days. It's a 2-day course, and it's approximately 10 hours, and then there's breaks also. So that first day is about 8 hours long or 6 hours long, and then that second day, 8 hours long with the breaks, and then the second day is about 6 hours long. The training, some states, I do see another question in the chat, so some states do offer it for free, so you would definitely need to check in your state. Now, the open ones from the National Family Support Network, the cost is $150 for that training. All right, so while we're waiting to see if anyone has any other questions they'd like to add to the Q&A, I'll go ahead and share some additional information with you. We have our webinar Wednesdays, which you're attending today, and that's a great way to connect with us. We want to just point out that on May 3rd, we will be offering that Tap into Quality, which is standards implementation in the state of Vermont. So we are featuring Vermont. They will be providing a webinar that is free. But I also want to mention that on our Webinar Wednesday page, you can see upcoming webinars there. And we also have a library on that page where you can click on different things. We offer our core webinars. So this particular webinar would be available there under core webinars. We have most recent ones. And then there's a whole library and subpages that you can click on for various different subjects. So I definitely encourage you to check that out. You just go to the nationalfamilysupportnetwork.org. And then you would click on the Webinar Wednesday page, and you can find all of that information and also reach out for those other things. I saw another question in the chat. How often must the certification be renewed? And it is every 2 years. So that certificate you receive is good for 2 years. And we're actually working on a recertification training, which would be a shorter training once it's developed. So at the end of that 2-year period, you could just do that recertification training to be recertified on the standards. Okay, so then I see another question about a school-based family resource center and how much physical space do you use? And as they say, if you've seen one family resource center, well, you've seen one family resource center because they're all so different. My particular family resource center utilized a classroom. So we had a whole big space. It was a big classroom space that we had available to us to use for our parents to come in for our programming, for our kids to come into the classroom. But you're also going to have community-based family resource centers, and then that looks totally different. They're probably going to be in a site that's off school grounds, obviously, because they're community-based. So they just vary depending on the type of center. We've actually had some family resource centers that operate in what some would consider probably a closet space. So the space may not really matter, because sometimes, like with your programs, you can collaborate with your other organizations in your community to be able to hold those services there, like maybe your public library, or if you have an extension office, different places like that that will let you actually have programs where you can bring a bunch of people in, and maybe your resource center itself is just a small based center that you're working out of. So I wish I had a better answer than that, but basically it could be as little or as much as you can manage to come up with. Okay, and then there's a question in the chat from Chantel Hunt. And is this one training we are talking about? Okay, I'm guessing that you're asking about the standard certification training. And yes, that is one training. and it takes place over 2 days virtually, 1 day in person, but we're working on the in-person version. So currently it is virtual and it is a 2-day course. And you do have to attend both days to get that certification. All right. So speaking of the standard certification training, if you're interested in learning more and becoming certified, I encourage you to go to that certification training page on our website where you're going to be able to see those upcoming training opportunities. I do want to mention that if it says there's a state hosting a training and it says it's closed, go down to that contact information and reach out to those contacts to see if you can get into that training. So I do encourage you to do that. I do want to mention that the National Family Support Network is offering 2 open trainings, one in April, the 27th and 28th. Registration is open and available. You can register by April the 17th. That's when registration closes. And there are still spots available. Our next one after that will be June the 29th and 30th. Registration is open now and will be open until June the 19th. And you can find the registration links for those either on that certification page or just on the home page of the National Family Support Network. That certification page is a great place to see if your state already offers the standards training and to find information on how you can reach out to register if they do so. Now, in the standards, we talk about the value of parent voice and involving parents in a meaningful way. So this particular training that's on this slide is for those of you, whether you're wanting to start a new parent advisory council or whether you want to strengthen one that you already have. So this developing and sustaining effective parent advisory committees training is a unique and highly rated virtual training for program staff to maximize the great potential of parent advisory committees. This training is co-trained by an NFSN staff member as well as a national parent leader. The highlight trainings that we have to highlight them, we have one coming up April 20th and the 21st. Registration is still open for that and will be until April the 18th. And then we have our next one after that will be June the 27th and 28th, where you can register there by June the 15th. And I'm going to ask if Katie will drop in the chat the link to our trainings page for that so that you can go there to click on those links if you're interested in registering for those trainings. Okay, so on this slide, I provided my contact information as well as the information for Julie Matusik, who is the Senior Manager for Standards Training and Implementation with the National Family Support Network. And we encourage you to feel free to contact us if you have any questions. I do want to mention that today's PowerPoint, as well as all of the handouts and the recording of this webinar, are available on the NFSN website by tomorrow afternoon at this time. And I do see another question in the question and answer section, and that's asking about the cost to have a closed training done for our contractors. There is a whole page on that, and there's a difference in price based on whether or not you're a member network or whether your state is not a member network of the National Family Support Network. For that information, you would go to the National Family Support Network website. And you would go to standards and drop down to the standards. I'm just going to do it because I want to make sure I'm telling you correctly. You go to standards of quality, you go to standards training, and there you will find all the information you need on how to bring and host that. So the cost is actually $7,500 for NFSN member networks, and it's $8,000 for non-members, and that's for up to 36 participants. And it includes all the materials for the training. Okay, so I am not seeing any other questions. I do want to mention again, as you're exiting the webinar today, we're asking you to complete that evaluation that's going to come up on your way out. We very much appreciate your valued feedback as it helps us to inform future webinars. And it's also exciting just to see what your next steps are. I want to thank you for being here with us today, and I hope you have a lovely rest of your Wednesday.